I just had the opportunity to spend some time actually with one of the authors from the poster, Lawrence Fisher, and I went to a poster that was looking at the reasons for individuals delaying or interrupting insulin therapy. And what I found fascinating about this was, we've been talking about this for a really long time. Like, we have all these barriers for insulin, but they have a larger scale survey that they have done, which has been submitted for publication. It's called the Emotion Registry. And they started to pull out pieces of information from that. And one of the things that they identified is that who will delay the onset of insulin. And surprisingly to me, it's people with the least amount of years with type 2 diabetes and a history of severe hypoglycemia. So those kinds of things don't necessarily always go hand in hand. You've not been on an injectable perhaps, and you've had a severe hypoglycemic event. So that is the individuals that won't start. But what about those that interrupt? Well, it's those individuals again that have had a history of severe hypoglycemia or hypoglycemia. They also are the individuals who have a higher BMI, and individuals that have, here's the one that's hard, they have fear based on what they've seen in friends and family. And so these are barriers that we're recognizing with insulin initiation, but it also apparently affects their willingness to continue on insulin. Those are the individuals that interrupt. I think my big takeaway from this poster and a subsequent poster that was a couple down from it is that when this particular data set is published, we're going to have a lot of insight into some of these barriers that we've just been using collectively. And we're going to be able to maybe do a much better job, as suggested by this poster, of assessing who these people are in terms of their barriers based on the characteristics identified, and then developing a strategy to deal with them.